You briefly touched on this, and when I received the Christmas card from you just a few weeks ago, this is King's Health Partners.
Yeah.
And just tell me now, Prokar, this is a professor of surgery and urology. You are chief. Just tell me what it is all about. And you are really fascinated to have the job, I can understand.
So absolutely, and I will try to simplify what is clearly a complex story. So King's Health Partners is a academic health sciences center. There are two others in London, and there are others in the country, but we are the one south of the River Thames. The other two on north are Imperial and UCL. King's Health Partners has King's College London, which is my employer, has been since I got my chair in robotic surgery and urological innovation all the way back in 2008. So King's College London is the university. And then there are hospitals around it, hospital trusts, which are NHS trusts, National Health Service trusts. So that includes Guy's and St. Thomas's, so two major teaching hospitals. King's College Hospital, just to confuse you, this is not King's College London, but King's College Hospital, which is at Denmark Hill, and the South London and Maudsley, which is the psychiatric hospital and includes the Institute of Psychiatry, probably the most prolific and the best known such institute in the country. So that is the King's Health Partnership, and I am the professor of surgery across all these sites. So I'm not just professor of urology, I'm in charge of the entire academic surgical department across sites. And before this, the similar position was held by Professor Kevin Bernard, who was a vascular surgeon. You will know him. He was at the United Medical and Dental School. So this wasn't King's Health Partners. That's what it was called in those days. And he retired, I think, in the early or mid 2000s, so almost 20 years ago. And then surgery became fragmented into urology, vascular surgery, plastic surgery, orthopedics, and so on. There was no professor of surgery. And so this is a new job, and it is there to showcase the fantastic surgeons, the fantastic scientists and educationists with a tripartite mission of clinical excellence, scientific excellence, and educational excellence. So I'm very fortunate. I have a fantastic team who work with me. There's a project management group. I have some great scientists. I have merged this with a new lab that we have just inaugurated at St. Thomas's Hospital, which is called Surgical and Interventional Engineering. This is led by my friend and colleague, Professor Sebastian Orselin, who's the head of biomedical engineering at King's College London. And we have put in the next generation imaging that you can have, the Center for Artificial Intelligence and Value-Based Healthcare, you name it, hyperspectral imaging, 3D printing, the fastest computers in the world, with the sole interest of doing surgical data science. So we have a cadaveric lab in it, multiple cameras. It is just like being in a next generation, Star Trek kind of operating room. And here is the important bit. It is placed in St. Thomas's Hospital, the hospital opposite the Houses of Parliament. So we haven't put this lab in some godforsaken corner of nowhere. We actually want to do science which makes a difference to patients, something that I have always believed in. And unless it is translational, there is no point in generating loads of public funded grant money and then failing to actually make a difference to our patients who need it the most.
Wonderful. Now, you did a lot of charitable work, I'm aware, and the viewers who spends fair amount of time doing the charitable work in UK. And I still remember vividly during the pandemic, he actually raised the funds for the families and the people in India who were actually suffering from COVID or COVID-related sort of problems.
Yeah.
Now, towards the end of interaction, there are a few things every surgeon or every doctor, comes to a dilemma, especially when you are treating your family member, your colleague, your close ones, and the decision is not very, very easy. The outcome can be different, and you require different courage and different sort of strength to undertake care of your loved ones. This is not a big secret. Your close colleague, Professor Roger Kirby, who is a big name in prostate cancer itself. In fact, when I was training, Roger was doing fantastic open radical prostatectomy. I used to go and watch him in London. Obviously, a good friend of John Fitzpatrick, a common friend. And you did surgery on Professor Roger Kirby, and it came as an interview in the newspaper. Now, Prokar, two things: how easy, how difficult it was, and what was your experience like?
Thank you. I will certainly come back to Roger's story, which was rather unfortunate because the man who was the prostate cancer surgeon in the UK certainly got the disease himself. And this came out driven by Roger. I didn't say anything to anybody, actually. And this happened because he wanted to educate patients about what it really was like to be on the other side of the robot. So he had a robotic assisted radical prostatectomy himself. But the background story to this is that we had started doing robotic prostatectomy in 2004, prostatectomy and cystectomies in 2004 at Guy's. And then, around the same time, as you know, some of our colleagues were doing robotic prostatectomy in St. Mary's, which was the only other robot. And the London clinic, which is where Roger was as a private urologist, was the first private hospital in the country to invest in robotics. And that was driven largely by him, myself. I was invited to come in, Peter Amoroso, his anesthetist, and Chris Anderson, another urologist, and Krishna Patel, and a fantastic team of nurses who came and learned how to do this. So these are the early days, and the London Clinic now have 4 different robots in completely different specialties: a Da Vinci, a Navio robot for orthopedics, a waterjet robot for a Procep for BPH, and recently acquired a spinal surgical robot for CT guided surgery. So it's the only such hospital which has really expanded its robotics program in the last 17 years. Now, Roger's story, as I said, is unfortunate. He had Simon Garfield in the operating room. Ben Chalakum was there, Krishna was there, and the whole team was there. So it was the same team. And Garfield kept asking me questions. So I actually didn't feel any stress because I had my head in the console. I couldn't hear anything. And once you're in the zone, you're in the zone. Yeah? And we did a nice, slick job for Roger. He woke up asking for, I think, a gin and tonic because of his thinking that James Bond is his hero. Probably is. But it was good looking after him. He went back to work very, very early. He put his suit on, and the next day was found down the road in the prostate center. And I had his poor wife screaming at me saying, "Why have you let him out of the hospital?" I said, "Look, he's feeling well enough to put a suit on and go to work. So who am I to stop him? I didn't even know that he had escaped." So there you go. And he really has spoken about it quite frankly. And I think most colleagues, most celebrities don't do that. But he has. So one has to give him the credit for actually bringing a surgeon's perspective to prostate cancer. So I'm grateful to him. And I tell you another thing. This whole program of teaching robotic surgery to the country at various centers was supported by one of those charities, which is the Urology Foundation, which I've been a big supporter of. The others are Malcolm Foucault Trust the Prostate Cancer Research Center, now called Prostate Cancer Research, who funded a major center at King's with 3 scientists and a fantastic team. And also the Prostate Cancer Foundation in Kolkata, led by Amit Ghosh, whereby we published a blog on Kavi Guru Rabindranath Tagore on the 50th anniversary of UCCon. You'd have read it, one of the most read blogs on the BJUI, showing that Kavi Guru also died of BPH and renal failure. So raising awareness amongst the public of prostatic disease rather than hiding from it, which is what most men tend to do.
Wonderful.